Human trafficking is a multi-billion-dollar industry affecting millions worldwide. No industry or country is immune from this problem. The hotel industry has a unique role to play in the fight against human trafficking. Trafficking networks often rely on legitimate businesses, including hotels, to sustain their illegal operations and infrastructure. For example, traffickers may use hotels to house their victims while in transit or to sell their victims forced services. It can happen in any hotel. Online ads bring buyers to the hotels. Events, conventions, conferences, citywide events, and sporting events increase the demand. This criminal activity presents a great risk for the safety and security of hotel businesses as well as legitimate hotel customers. Fortunately, there are many ways in which the hotel industry can help prevent and combat human trafficking.
I've been working in this industry for 27 years, and I believe we can help raise awareness and in turn equip and empower hotel owners and employees to help put a stop to human trafficking by doing a few things. First, by formally adopting a company-wide anti-trafficking policy that articulates the company's commitment to combating all forms of human trafficking, sex and labor, adult and minor victims, U.S. citizens, and foreign national victims at all levels of business. The policy should be clearly communicated and implemented at all levels to ensure that there's no human trafficking on site, within their own workforce, or within the company's sourcing and procurement supply chains.
Yes, a formal policy would be a huge help. I also know that there was a law passed requiring hotels, motels, places of lodging to provide training for their employees. The law took effect January 1st, 2021, and affects employees of hotels and public lodging, doctors, licensed massage parlors and spas. Businesses that don't comply actually face fines of up to $2,000 a day, and even the healthcare industry is not immune. In fact, the healthcare industry has a unique role to play in the fight against human trafficking. In one study, 87.8% of trafficking survivors reported accessing healthcare services during their trafficking situation. Of those, 68.3% were seen at an emergency department.
I've been working as a pediatric advanced practice registered nurse for the child protection team for the last 6 years. I believe it's critical to educate, equip, and empower healthcare employees to help put a stop to human trafficking. There's some general signs that we can look for, especially in the emergency departments and urgent care centers, where a trafficking victim may end up for emergency medical treatment. Some of those examples might be an injury that's observed, and if you ask the patient how they obtained that injury, if the history isn't consistent, or if they're not able to provide a direct answer, that can be a sign. Sometimes we may see patients with tattoos. Some of them look like the word daddy. It may also say for sale. We've seen some that have princess with a crown. So you can just ask about that. If they come in with their trafficker, a lot of times the trafficker is a very dominating person, speaks over them, doesn't allow them to speak for themselves, or they may defer to the person that they're with.
Training is essential to identify and respond to human trafficking. Education should occur annually at the point of hire and include staff of all levels, property owners, general managers, and line staff. Everyone should know how to identify when a suspicious situation may be human trafficking. Training should incorporate internal processes and protocols for how to respond to and report human trafficking. This is one of the reasons that I'm excited about volunteering with Harbor Hope. Harbor Hope has created a training for those in the hotel and lodging industry that's very informative when it comes to the signs to look for.
Yes, community education is one of our passions. We believe that awareness and education is half the battle.
It is important to address the immediate needs of a patient, but healthcare institutions should also plan for the likelihood of encountering a trafficking victim. Hospitals, clinics, and other providers should build internal protocols for how staff should respond in suspected human trafficking situations, which should include how and to whom reports are made and identifying local service providers who can serve trafficking victims.
Absolutely. Concerns of human trafficking or severe labor exploitation need to be taken seriously, investigated in a timely fashion, and remediated as quickly as possible. Developing an internal process for responding to and reporting human trafficking when it's suspected on site, within the workplace, or within the supply chain is critical.
A couple of years ago, we received a call asking for resources for a victim of human trafficking. We learned that this young person had been introduced to a trafficker by a coworker. The trafficker picked her up from her place of employment, drove her out of state, and began selling her from a motel. The 17-year-old girl contracted an infection and was taken to the local hospital where the staff had been trained on signs of human trafficking. They were able to intervene, contact law enforcement, who then contacted the girl's family so they could pick her up. I'm quite certain that both the young lady and her family were grateful that those hospital staff had been trained on the signs of human trafficking and how to respond. It's amazing how knowing the signs to look for and how to respond can empower us to make a difference.